Hi, I'm Dr. Angela McKay, chiropractor and naturopathic physician, and September is PCOS Awareness Month. So I want to talk to you about what PCOS is and what you can do to treat it. So PCOS stands for Polycystic Ovarian Syndrome. Because it's a syndrome, it's not classified necessarily as a disease, so there are a lot of components to it that may or may not fit your particular case if you think you may be suffering from PCOS. But it is a pattern where women don't ovulate, eggs build up and create cysts along the edge of the ovary, and it can cause pain. You can have ruptured cysts that can be really very painful, and in some cases can become life-threatening. You can have irregular periods, so you can have cycles that are 45 days apart, 90 days apart, really painful periods when you do have them, and have severe cramping and heavy bleeding and difficulty there. It can cause a lot of hair growth around the face, as well as on the chest and abdomen, and it can cause a lot of acne, especially in the jawline and through here. In addition to all that fun stuff, you can also end up losing hair on your head and end up with like male pattern baldness. It affects fertility, so it can lead to infertility. It can be really difficult to get pregnant, and if you do get pregnant, it can be really problematic maintaining a pregnancy, so you may end up having miscarriages or losses of babies that you were hoping to have. It also increases your risk of heart disease significantly, something like 5 to 7 times the normal rate of any other person. It also greatly increases your risk of gestational diabetes. That's diabetes that you have while you're pregnant, or just generally diabetes, type 2 diabetes. Those health risks are really important to note. Along with those risks comes the risk of stroke, sleep apnea, and if you're not having regular periods, you're not shedding the lining of your uterus, it greatly increases your risk of endometrial cancer. PCOS, or polycystic ovarian syndrome, affects approximately 1 out of 10 women. So this is a super common syndrome that affects a lot of women. A lot of women don't know they have it until they're at childbearing age. But it's something that I see and treat all the time because it is so common. Women who do have an issue with weight, it comes on really easily, and it's really hard to get it off no matter how much you exercise or what you eat. And if you're not eating enough, in fact, you can slow down your thyroid and make it even harder to lose weight for yourself. So that is the overall picture of PCOS, what it is, kind of how it starts. And so let's talk about what the motivation is to do something about it.